Welcome to Beyond the Balance Sheet. My name's Katie Collin, and today we're talking about the mental load of working in primary care and what tools and techniques you can use to stay clear-headed and effective as a clinician and leader. I'm delighted to be joined by Dr. Matt Slavin, who's a clinical psychologist and is going to unpack this issue for us. So thanks for joining us today, Matt. It's really good to have you on the podcast.
Thank you very much for inviting me.
So tell us a bit about what you do and your experience so far.
So I'm a clinical psychologist, as you say, which is my background is in severe and enduring mental health. That was my training. But I see my role as twofold. It's like an imaginary seesaw. Part of my job is to help people from suffering, whether that be stress, anxiety, depression, burnouts, to elevate distress back to their status quo, back to where they feel comfortable. But the other side of the seesaw is also to help leaders, people performing hard work to be their very best self. And my great belief is that psychology can help us show up in the way that we want to and be our very best versions of ourselves, if only we know the right stuff.
Yeah, no, that sounds amazing. And I suppose we probably see quite a lot of that in primary care, with certainly when you're talking about stress and anxiety and burnout. Maybe what we don't talk about enough is actually the flip side of how to get ourselves as being really strong, effective leaders. So very interesting to hear that. What do you tend to see with primary care and some of the issues that we're facing at the moment?
I suppose the main thing is stress.
Yeah.
Like it's a very stressful, demanding role. And I think in my work, which might be individual work, so people come to see me privately, one-to-ones, or in workshops, is that there's an increasing amount of emotional stress, whether that's be supporting a practice or the increasing demands in a profession that is all about caring for others and giving to others. So one thing that definitely shows up a lot is people getting so stressed that their body takes over. They end up in a state of burnout or physical sickness, backaches or injury that takes them away from the workplace. But also things like compassion fatigue, where they just get very tired of caring for others and they don't feel themselves. They don't enjoy the work. And that's also, I meet people at life transitions, people either returning to work, people questioning if they can continue, major life transitions where they're thinking, is this really for me now? Maybe they're wanting something different for their life.
No, that's really interesting because, we obviously see our clients all the time, talk to them all the time. And I think we're going through quite a big transition now of what the NHS is going to look like, what healthcare is going to look like, certainly what primary care is going to look like over the 10-year plan. And I think that probably echoes some of what you're talking about is people going through that transition and actually taking a step back and saying, actually, what does this mean for me? Where am I at my life? And I think probably over the last 5 years, certainly with COVID, we've seen a big shift in how people work. Is that something that maybe you think has been a bit of a trigger to making people question how they're working and their work style?
I think undeniably. I think one thing COVID did was it got everybody to reassess where they want to go with life. And some people had it was a very stressful event. We kind of forget that it happened, but it was a very stressful event to go through COVID-19. And so many people reassessed. They think, well, what do I actually want from life now? What feels really important? And many people have made this more deliberate choice to, we might say, have balance or prioritize family more or to think about their purpose more rather than just showing up and doing a job. So whether that's the younger members of staff coming in, and we've seen rising rates of people doing part-time work. So they're coming in with a portfolio of work. So they want to have more meaning and interest and maybe less stress from holding a practice. Or I think the other thing I've seen is many senior GP partners decide maybe they'll take early retirement. Maybe that's enough for me now. And they'll finish up and they'll do something else because they're always interested people. They'll find something else to be interested in, but not necessarily holding the weight of responsibility anymore. And past COVID, also the amount of demand that's also on primary care following COVID-19, I've seen a lot of people make some big decisions of change.
Yeah, that's actually a fair point about people retiring. So we've seen this transition as well in the last few years that particularly changes around pensions. So I won't get into techie pensions now, don't worry about the NHS pension. But certainly, obviously with the 95 and 2008, but the 95 scheme, a lot of people have a retirement age of 60. And the thought process has now been, actually, I think I will take my pension at 60 or I will take my pension at 58. And that has led people to leaving earlier, maybe those sort of senior partners who've been there for a really long time and have a wealth of experience of running a practice, they're taking a step back and either taking either a salary post or taking time out completely and maybe doing one sort of locum a week or something like that, one locum session. But a big shift in terms of that, we call it an exodus. I'm not sure it's as dramatic as that, but a big shift of people taking that step back. And then the question is well, who fills that gap, and are the next level of GPs ready to take on that next role?
Yeah. I think some of the unspoken things that happen in the changing of the guard is that there's so many unwritten rules about how any practice works, how we run things. If we think about a system, if I go back to systems theory, so if we think about families are systems. In my work as family therapist, is that we think about how a family system works, but any system, a team, an organization, a living being is a system. And we'd say in systemic theory that all systems like to return to homeostasis. So you try and change things. Everyone likes to come back to what we already know. You like the same thing.
I get that.
Yeah. So when you see a team change and you see people who've moved on and they'll decide, senior GPs will retire, that there's now a change, there's going to be a pull to go back to how we did it before. But of course, the system is now different. It can't accommodate that change. And so there becomes lots of unspoken stresses and uncertainties about how did they do things? How do we replicate this? Or maybe we need to change now. There will inevitably need change to happen. But that's a work for teams. Sometimes we think about big organizations, they've got teams around them who help them navigate change. No one likes change. I said beings don't like change. Organisms don't like change. Humans at our heart, we don't like change. If we go way back to when our brains were designed and evolved, it was in the tribes of Stone Age days. And change or uncertainty was closer to risk and ultimately death. So our brain doesn't always know the difference between change and that fear of survival. So often we cling to old ways, or people get extremely stressed or irritable around those times. And that's exactly the same time where you're trying to foster new relationships and new ways of being. So that could become a really challenge point in any practice.
A very real example of that is, I've mentioned to you before, we've had people come to us who said, well, actually, the previous partners have all retired at a similar time, and that brings in a new wave of partnership. And then those new partners often then have to go off with stress on long-term sick or end up struggling. And I think part of that is the obvious things like, paying out lots of partners, the financial pressures that come with that, taking on the responsibility. But actually, it's more of sort of what you're saying there is that actually there's a psychological change in terms of how you manage that huge transition and how you prepare yourself for it.
If I go back to the systemic theory, one of the theories that we hold on to is the family life cycle. Is that what's meant to happen in a family life cycle change is that, I am talking about families here, but it will make relevance to teams in a second, is that as generations get older, there is this change that we all go through where our parents get older, they become the older generation, the younger generation have families of their own, then we'll have our own children, they'll have their own children. Every generation has to accommodate a change of role and purpose. And what we'd say, in those times of change and purpose, that is where most problems happen in families. Usually what happens is there's a problem in the system and it gets represented in an individual. And that person you quite often see in family therapy, we get a referral for somebody who comes with anxiety or depression. In family therapy, we say it's not necessarily him, that person, who's the depressed individual. The system, for some reason, wants to treat them like the young child, and that's why they're depressed still. Or placing undue responsibilities on one person, that's why they're anxious. So if we come back to teams, I'm talking about individuals here we're saying some people will feel very stressed and overwhelmed, but we also have a look at the whole system of the team, because as they're accommodating this new change, it's likely that somebody or a few people are going to find it personally very hard. And so okay, my work is we come back to the individual and their psychological self-awareness and skills that will help. But you need to look at the whole system and say, well, what are you doing as a practice? What are you doing as a whole culture that's speaking openly, having the difficult kind of conversations, naming things out loud which kind of go under the breath and get frustrated about? Because if you can balance out the system better, help them navigate this new change, then that's also going to lead to a lot of psychological safety and health for everyone involved.
That's going to be so relevant. I mean, I can just think from a GP perspective in terms of partnerships. Of course, you've got lots of different people, lots of different issues, high volume of work, high volume of stress. But also, we're now in this phase where you've got primary care networks. So you've got multiple GP practices working together. We're going to lay that into neighborhoods where you're going to have multiple PCNs working together, plus, secondary care being involved. So there's going to be a huge shift in dynamic. And I mean, talking about that sort of transparency and open communication is going to be absolutely crucial. I can imagine going forwards, working together in a period of change. Just interested, do you do work then with practices where you go in and see these sorts of issues and run courses with them?
That's right, yeah. Sometimes it might be a workshop to talk about a theme like psychological safety or psychological resilience. Like, how do you keep practicing well when you are stressed? Because I don't have the powers. I don't think you've got the powers to take away the stress. It's going to be there. But stress isn't necessarily a bad thing. It's how we can harness it or manage it or put boundaries around it that's really important. So sometimes it's workshops or sometimes it's consultancy, going in and talking to partners and individually working out anonymously what's really tricky, what do you find hard, what do you need the other partners to know, but necessarily you don't want to bring up because there's always the fear of being outed or being the difficult one. And then my work is to then come back to them and then have workshops based on what happened out of that consultancy. So anonymously, talk about the themes that need to be talked about. Because one, there's never enough protected time in a GP practice time to talk about the difficult things. But we're just humans who want to get along with each other, mostly. It's really hard to then say the difficult thing. But one of the main things we can do to overcome challenge is to say out loud the difficult thing.
Yeah.
That takes the power out of it and it's workable. Otherwise, people will leave, get sick, be frustrated, or it'd be an unpleasant place to work.
We see a lot of that. I'm really fascinated with this idea about stress because we often talk about stress in a really negative way, and we see a lot of that with our clients in terms of, GPs are very stressed, primary care is very stressful. Stress isn't always a bad thing, as you say. I suppose it's what the implications, what the effects of the stress can be is when that potentially turns negative. I mean, you mentioned burnout. That's something that people talk a lot about, and we do see people going off with burnout. Why do you think that happens? What's the tipping point from when stress is a positive thing to when it becomes burnout?
So if I come back to the neurobiology of stress, our body has a few different ways we cope with the external world. And they're all survival strategies. We learned these a very, very long time ago in our evolution. And we learned some things that are really effective. So one of the things to do is when faced with adversity is to flood our body with hormones that get us woken up, able to fight, flight, freeze, flop. When we do fight and flight, or when we're trying to be really full of energy to combat a difficult thing, our body floods us with a number of different neurotransmitters and hormones, but some familiar things might be adrenaline, cortisol. So those are our stress hormones. So when we get faced with stress, we can either see it as a helpful challenge. Now, I don't know if you remember doing your exams, as awful as they might be.
Very clearly, yep.
Or when I'm thinking about doing any of my workshops, if I'm working with my clients who are athletes, we want a little bit of stress to be at your very best. You turn up to an exam, you want to be nervous because the nervous energy actually is your body telling your brain to say, wake up, this is important, do something good about this.
Yeah.
So you want to show up and have your best mental faculties. And we know there's a bell curve, a normal distribution curve, that where you get to the central point of a normal distribution curve with stress, that's your most effective way to show up. So you want some high levels of stress, but not too much stress. Then we end up being flooded by stress. We might call it emotional hijacking, which means your emotions hijack your brain. And then you're being led by your emotions or your base instincts, fear, and not by thought and intention. So firstly, when stress is unuseful, it's when it's overwhelming your capacity to think. We know the brain is hierarchical, so that when you have too much stress, your base part of your brain, I'm waving at my head here, I'm waving at the back of my neck, which is our base part of our brain, our reptilian brain. This is going to determine the release of survival instincts, survival hormones. So we go into fight and flight. Where we want to do logic and thinking and reflective capacity happens in the top part of our brain, which is our prefrontal cortex and our cortex. Now, our cortex, our thinking brain, it will go offline, inverted commas. It won't think effectively when we're in a huge amount of high levels of stress.
Right.
Because our brain evolved to say, danger needs us to move faster than you can think about it. So it just goes with instinct. So if we're too overwhelmed, you can't think clearly. So that's a warning sign if you're reacting instead of responding. But burnout happens with the prolonged activation of intense stress. We're very good with short bursts of stress. That's when humans are at their best.
Yeah.
But chronic activation of stress does really unhelpful things for us. Far-reaching things, it will overload your heart system and it would lead to cardiovascular problems.
Yep. We see a lot of that actually happening in primary care. It's well known.
Really? Well, so yeah, that's not a good thing for our physical health. Digestive issues, headaches, and going to be there. But prolonged activation is going to lead to three main symptoms of burnout, which is, firstly, it's going to be dissatisfaction with your job, cynicism, people turning up and really not wanting to be there. The impact on concentration and cognitive ability. So your cognitive ability will decrease. And persistent feelings of fatigue and tiredness. That even when you wake up, you don't feel woken up.
Yeah.
So my phrase for being close, or maybe at burnout, is tired and wired. You're so tired that you feel exhausted permanently, but you can't switch it off because something needs you. And when those things happen for a long period of time, the body says no, and the body says stop. And it might look like a physical health issue, it might look like a mental health issue. Something will happen that forces you to stop. And that's not a nice place to work with anybody, but it's an important time to work with somebody to help repair why they got there in the first place and give them the skills to get strong again. And importantly, the skills to never let it happen again.
And I suppose on that point about the never letting it happen again, I think we do have a bit of a cultural pattern of we get stressed, burnout, we go off, and then we come back. And we come back thinking, okay, well, I've had some rest now. It's a bit like, oh, I'm really tired. I'll go on holiday, have some R&R, and then I'll come back and everything will be fine. And from your experiences, is that the case? Or actually, does it require something more than that?
I think so. If we're diagnosing a problem, we could address the symptoms, which would be the physical things I told you about, or we could address the root causes, which is there were structural reasons and deeper reasons why somebody faced burnout. And unless you face those systemic and deeper reasons interpersonally and intrapersonally, then it's going to happen again. There'll be another, the stress isn't going away. Practice doesn't look like it's going to get any easier anytime soon. So absolutely. You've got to work on the systemic issues, so how teams work together, how people relate to one another, and how somebody relates to their inner world, their inner universe. That's the bit that I do too.
And what do you see are kind of key ways that people are maybe making that change in the structure of how they're working?
So working with greater intention, that's for sure. That if you're going to make a change, you've got to have a reason why you're going to do it. So I often get people I work with, my clients, I'll often firstly get them to work out what's the most important thing for them. Why are they doing this? Why are they going to make a change? Because change isn't easy. Like I said before, we all want to go back to what we did before. So you have to connect with why you want to do it. What's your North Star, your compass bearing? For some people, it might be for their kids, to show up as a better husband, for their patients. Whatever your why is, you've got to find it. And then it's drawing better boundaries around your work. And that's hard, but there are some very practical things you could do. Like change your environmental architecture. So when you finish your work, don't find yourself looking at things that remind you of work. Otherwise, you will think of work. And our brain works by association. If you see something that reminds you of work, your brain will think about work. So when you pack your laptop up, it goes in the bag. It doesn't come out again. The bag is not visible. If you've got emails on your work phone, you can take them off your work phone. You have to put them back on the next morning. Finding ways to down-regulate at the beginning and the end of the day are really important so that you're giving your body the cues of relaxation before you start. It might be do some sport. You might do a walk in the morning. It might be meditation before you start your workday. And something to unwind as well. We used to have the commute. Not everyone's still you might not have a physical commute. Even if you don't, you're having a work day at home. You need to have a commute where you leave work and I heard Brene Brown talk about this. Do you know who Brene Brown is?
Yeah.
She was talking about this metaphor of a lock, like a canal lock,
Okay.
is that between the high water and low water, there's this compression space that you need to step into. And then if you've ever been through a lock, it takes a very long time to
Yeah.
slowly release the water. And the whole point of the compression system of the water is to release pressure slowly to move into a new state, a new place of the canal. So you need that. We still need that kind of lock space where time to decompress. Otherwise, you could leave work very stressed, walk into home. If you've got kids, life does not stop. It gets busier the minute you get home.
Yep.
And then you've got new demands on you. And so, as I said, chronic activation of stress is not good for us. That we need to find ways that you learn the skills, whether it's all the things I mentioned about boundaries or whether it's psychological skills of breath work, of visualization, anxiety management skills, thought management skills, things we can learn. You learn all those things that give yourself pockets and periods of micro rests and resets to turn your nervous system, your autonomic nervous system, from a high adrenalized state into a restful state.
And I think the challenge that also, a lot of GPs face is part of the environment, the working environment, is you're having people coming in every 10 minutes, which is probably not long enough to be able to, listen, diagnose, treat someone. But it's continuous. It's that continuous listening to that all day and almost taking in that workload. And then, of course, you say about, it's really important to sort of pack up and your laptop and decompress. But of course, at that point, most of our GP partners are then doing the other part of their day job, which is running a business. And that's, I think, a big challenge. That how do you find that time to do all those things and find the time to do the job?
I don't know how. I don't think you can do. You can't do it all and feel on top of it the whole time. So another exercise I've done with some of my GPs is to get them to write out what's their statement of what a good enough job is. And I get them to write them out about, today I'm showing up to work to do, and they'd write their 1, 2, and 3 things, which have acknowledgement of the limits of their capacity within it. That they're going to show up today to provide the best possible care they can do for that person in front of them within the confines of 10 minutes they have. Whatever statement they're going to write. But it's important to write that out and hold that in mind. Otherwise, it's always going to feel like you're not good enough. You could have done more. If only I had, then I would be. And that must put GPs in a constant state of never good enough or never satisfied or quite doing all they wanted to do. I think some willingness of acceptance here is important, that's not going to change all that soon.
Yeah.
So having some statements that says I'm doing the very best I can with the limits that I've got is really important.
I think we can all probably relate to that to a degree. There's something you mentioned earlier that I think is absolutely fascinating, which is this idea of compassion fatigue. And I think sometimes we see a lot of what's put onto primary care, and not just GPs, but all primary care institutions, is this constant sort of benchmarking, this pound per patient mentality. You've got to do this to hit this. You've got to do this to do this. So all these targets, of course, we've got the new access appointments. You've got to deliver this in time for your patients. A lot of the rhetoric almost sort of forgets about the patient a little bit. And it talks about what you have to deliver. I wonder if you think that might have a knock-on impact in terms of that compassion fatigue, because sometimes we actually aren't told about, just sitting down with the patient, looking after the patient.
Absolutely. I mean, I think if you think about your own experiences going to, why do people go to GPs? They go to GPs, we're talking about GPs right now, they go to GPs in times of distress. You go in with a problem, and quite often it might be a very big problem. And the first time you've admitted out loud it's a very big problem. We know that one of the most healing things you can do is have somebody sit with you, look at you, not a screen because you're typing notes, but look at you and meet you in your time of distress. And that's one of the most effective things a doctor can do to help someone in that journey of their very first step of talking about a very difficult thing. But as you say, it's very hard to do that job as a GP and also make sure you're writing very quickly and you're hitting all your quotas and to actually have the capacity to do so. And so I think that's a major issue and a major warning sign that if you're losing your ability to care for others, you lose your compassion fatigue. it's probably speaking about this nervous system on high alert all the time, and you're really struggling to care. We might also call, so when I was when I was doing my training, we'd call the same thing in 3 different ways. We'd say burnout, compassion fatigue, secondary trauma. We'd use those words for slightly different meanings, but we'd use them a lot. So yes, someone's nervous system, a GP's nervous, might be on alert all the time, exhausted. But it also might be that the way they would see it is they're finding it very hard to care for the very reasons they got into their practice. Surely your reason to be a doctor is because you want to care. Or thirdly, that it's secondary trauma, is that if you're surrounding yourself with people's most difficult days and they're bringing with you, GPs get access to people's whole private worlds, that we can't help but take that on. A good GP should take some of that on because they should show empathy. But there's the skill in being able to hold enough of that to not be drowned by that. And then the ability and the need for rest. If you don't find ways to rest or get it out of you as well, that's why coming to a supervised practice or speaking to somebody else is really important, where you get to offload the stress and all the things you've been through. Otherwise, what stays in you will fester, and those things aren't healthy.
And that actually makes me think of going back to sort of basics. The GP partnership model is such a wonderful model because you're partners and you're sharing that together. And I think sometimes when we talk about, these big at-scale organizations, we actually forget that sometimes the most effective model when you're in that high-stress environment is actually having other people to share that with. And that's a camaraderie and I suppose, a team that you don't often see in a workplace. It's unlike any other. And I suppose that links slightly into what you do in terms of your teamwork as well, and team building.
Yeah. One of the most effective ways to manage difficult experiences is to talk about it for a few different reasons. One is that we come from tribe, so we're meant to be a tribe. Secondly, the minute we start putting language to an internal event, we say, that's hard, I was having a really tough day, that thing really scared me. Once you put language to it, we know that no longer we're being led purely by our lower brain, and we're using our cortex, because language only exists in our cortex. So we know once you can name something, you've got some taming of it. You're using your cortex to manage it. And we know that actually the best thing we can do after a difficult, stressful, traumatic experience is to talk. Lots of religious experiences, lots of religious customs are about talking after difficult events. Lots of good guidance, like Harry Potter, tells you once you go through a difficult event, you got to make sure you talk about it. Dumbledore makes you talk about the loss of your good friend.
Yes.
Because talking is a great release. Otherwise, what we hold inside, I said before, what we deny will amplify, will only build stronger. So yeah, having that trusted relationship, that's the key, right?
Yeah.
With your GP partners, where you can just go see each other and say, can we just have a minute to talk? Wouldn't that be lovely?
Yeah, and to share it, absolutely. So something you said earlier on was a lot about leadership and bringing out the best, and we talked a lot about burnout and stress. I just want to flip that to sort of the other side of the seesaw, because that's really interesting as well in terms of how you bring out that really positive, that high achieving, that successful, enthusiastic part of yourself. And obviously you talked about, with athletes, and that's probably a measurable way of seeing that in terms of performance. We're going through this 10-year plan, which is supposed to take effect come April. We're going to see at-scale organizations. We're going to see new teams building with new structures happening in primary care. Are there any kind of key tips in terms of being an effective leader, or flipping on that seesaw, some really positive things that you can give our audience in terms of things that they could be doing?
Okay.
No pressure.
Pressure's good. Okay, I'll say the first thing, so we're going into performance psychology. So I'll go with some shorthand ideas, but the deeper principles to start with is that understand yourself well, know your limits and barriers will be the key to high performance. So understanding the way that you work individually and your own barriers, your own mental criticisms, the own things that you find difficult, the more you can own that and work through them, the more you're going to be the best version of yourself. So then if we come down to some practical bits, what could you do? So one thing that is going to set people apart and set your best version of yourself apart is your ability to focus and pay attention. So when in a world of increasing appointments in a world of stress and uncertainty, one thing that's going to happen is that your focus, your ability to sustain and select attention, focus on one thing at a time, deteriorates. We have we again have a survival-based attention system. We have our involuntary and our voluntary pathway in our attention system. Our involuntary pathway says, I need to scan around the room all the time to make sure no danger's coming. It's like the meerkat that stands on top and looks around. But our brain does that all the time. It's only when we can teach our brain that things are safe right now, the meerkat's allowed to just be quiet, and we can do the focus selecting thing. So there are skills we can learn about how to sustain and focus our attention. Some practical things you can do in the meantime is to know some facts, like it takes us on average 22 minutes to return to a focused task if we've been distracted away from it.
Wow. That's very specific, 22 minutes.
That's some research.
Yeah.
Right? So there's a lot of research to say that most people living in the digital age now have a thing called continual partial attention. We're always half listening while we're doing two things at once. That's okay, but we do know our attention is a usable resource. Once you use your attention too much, too many decisions in a day, then you're going to fatigue, and it's very hard to then be your best version of your critical thinking, selective self. So there's got to be time. So I would say high performing, a few things to hold in mind is doing things that are going to reset your attentional focus. So nature is an amazing way. Spending time going for a walk outside, having mental resets built into your day, brain breaks are key to high performance. Also, to not try to do multiple things at once when the world demands it of you, to be boundaried about that. At least identifying in your workday when is your best version for deep work. If you have to do your admin, paperwork, clerical tasks, write something, when's the best time in your day for it? And you need to protect that. You need to tell your partners, I'm not doing anything right now. That's my protected time. So focus there. And there are ways you can train your focus as well. So meditation, mindfulness meditations are great ways to train our ability just to pay attention on purpose to one thing at a time. That's going to set you apart. If you can really do those things well with your attention, you're going to be the best version of yourself when it counts to show up.
I think that sounds also a bit like the way that we structure what we do and how we work, certainly going forwards, will need to shift. So as you say, there will be protected time that you might need to take out, and working out, I suppose, as a team, who's doing what, who's taking responsibility for what, and really, I suppose, focusing on what resources you've got as a team, as a GP practice, as a PCN, as a neighbourhood, whatever it might be, and really putting the right people in the right space and listening to each other, which I think will probably be quite a big challenge, what we've got going forwards.
If you think about that meerkat, if that meerkat in your brain cannot relax unless you know somebody else is doing the job for you.
Yeah.
So unless you can say, I've got 2 hours now to really focus on this thing we need to do, whatever it is that you've got to do, you can only do that if you are confident that I'm allowed to. Otherwise, you'll be thinking, you'll be listening in, you'll be partially attending, and you can't think at your best. The other thing I'll mention as well is one of those so there's lots of grounding, stabilization skills. So how to keep focused in the heart of high stress. Those are teachable skills. I would say the best things you could do for quick things you can get high bang for your buck on are learning good breathwork techniques, learning good visualization techniques, and we'll go into the world of how you talk to your inner self becomes really important here. So the old proverb goes, in our brain, in our head, there are two wolves, a wolf full of hope and full of future and full of good things, a wolf full of darkness and decline and hopelessness. And they're continually fighting one another. And in our proverbs, we'd say, which wolf wins? It's the one that you feed. So we could think about our inner world as having a voice of our inner critic and our inner coach. And we all have an inner critic because our brains were built for problems and for survival. So most of us have a negative dialogue in our head that says, you're too slow, you're too fat, you're too ugly, you're not good enough, you'll never reach this, you're an imposter, whatever your version is. That talks a lot throughout the day. one of the great skills in being your very best self, of breaking through these barriers of being the best performer you can be, or leading a team, or whatever it is for yourself, is to be able to identify your inner critic, label it, and to find ways to also silence it. At the same time, building up your inner coach. So you also want tactics to be able to talk to yourself in a positive way. This isn't whitewashing experience with positivity, saying there's nothing bad here. But when you're facing a moment of hardship and stress, and you're really, say you've got a really difficult client in front of patient in front of you, and you're really worried, and at that moment it matters how you finish this before you move on to the next of your leadership tasks, the ability to stay clear-headed and confident and saying to yourself that you're doing the very best thing you can will make a huge difference whether you can let it go afterwards and you can move on to your next thing.
Yeah.
So that ability to let go and ground yourself, but also the ability of speaking to yourself in a positive manner, matter, because you are going to be facing hard times. So the skill to be calm under pressure or good enough under pressure, those things start separating how you perform.
Wow. Can't top that. That was absolutely fascinating to listen to. I mean, I think there's a lot there that we can all take away in terms of high-performing teams, but I think definitely where we're going, the direction of travel, the things that people can do to protect themselves and sort of protect their time, and I suppose finding that compassion again and really enjoying what they do. There's some really great tips. Thank you, Matt. And thank you so much for your time, for joining and for clarifying all those issues with our audience. It's really always great to hear your thoughts. So thank you.
Oh, thank you so much for having me on.